Hello, I'm Dr. Neetha K I R, Associate Professor at Kasturba Medical College and Hospital, Manipal. So today we'll be discussing glaucoma. Glaucoma is the world's leading cause of irreversible blindness. By irreversible blindness, we mean that vision lost due to glaucoma can never be regained. So what is glaucoma? Glaucoma is a disease of the optic nerve of the eye. So optic nerve is a nerve that connects the eyeball to the brain. It transmits information from the eye to the brain. When the pressure inside the eyeball is high, more than what the eye can tolerate, it puts pressure on the nerve and the nerve gets damaged. So who is at risk of glaucoma? Anybody above the age of 40 is at risk for glaucoma, and as the age advances, the risk of glaucoma also increases. Another set of people who are at higher risk of glaucoma are those who already have relatives with glaucoma. Like if your parents have glaucoma or your siblings have glaucoma, you are at about 10 times higher risk of developing glaucoma. Now, people with myopia or short-sightedness have a risk of developing something called open-angle glaucoma. People with long-sightedness or hypermetropia are at risk of developing angle closure glaucoma. Now the problem with glaucoma is that it is asymptomatic. People do not realize that they have the disease. It is said that in developing nations, more than 90% of the people with glaucoma do not realize that they have the disease. There are no indications like redness, pain, and even the decrease in vision in glaucoma is not evident in the beginning. The decrease in vision starts from the side of the visual field, and till the central vision is lost, people do not realize that they have some problem in the eye. So it is important that glaucoma is detected early and this progression of disease is prevented. To detect the disease early, what is needed is that everyone gets their eye tested or screened for glaucoma proactively. So you have to go to an ophthalmologist and get your eye tested. And when you visit an ophthalmologist, what they do is they look into your eye, they measure the pressure inside the eye using specialized equipment. And they also look inside the eye using special lenses to take a look at the beginning of the optic nerve, that's called the optic nerve head. So if the pressure inside the eye is high, or if the optic nerve has got certain indications of having been damaged, then you are considered a glaucoma suspect, and then you need to undergo further glaucoma investigations. So the common glaucoma investigations that are done are, the first one is the visual field test. Visual field is the part of the environment that is seen by the eye at a point. So in glaucoma, like I said, the vision decreases from the side. So when this visual field test is done, we can get to know whether there is any damage, and it could be indicative of glaucoma. And the other important test, the second test, is the OCT scan of the optic nerve head. So like I said, this is the optic nerve head inside the eye. So the scan is done looking into the eye from the front, and the scan will show areas where the nerve is thinned out or any other damage is there or not there. So based on this, we can come to know whether the person who was a glaucoma suspect actually has the disease or no. So the treatment usually available for glaucoma are of three kinds. One is medications, the next one is the lasers, and the third one is surgical options. So medications for glaucoma are given in the form of eye drops. So the patients have to use these drops regularly on a daily basis. So initially we may start with one drop medication, and we might add more depending on how your eye is responding to the treatment. Now, if the disease is not controlled with medication, the next option is to do a surgical management of the disease. So surgical management, there are again multiple options, and the doctor would choose what is best for you. Another option I said earlier for glaucoma treatment was the laser. Lasers can be done right at the beginning before starting medication or after starting medication. It can be done at any point of time. What is important to remember is that glaucoma is a disease without symptoms. It is called the sneak thief of sight. So it is important that you proactively go get your eyes tested, and it is important that if the glaucoma is detected, you start treatment early and you stick with this treatment for lifelong. Glaucoma cannot be cured, but it can be very well controlled with treatment. So everyone above the age of 40, please go get your eyes screened for glaucoma today. Thank you.